Hi, this is Rich Polvino with Carestream Health, and I'm here with Marianne Matthews, Editor-in-Chief of Imaging Economics. And we are now on the last day of AHRA. So what would you say have really been the highlights of the show so far?
Well, there have been quite a few topics of interest here, and I would start by saying there's a lot of talk about quality, and when you hear that, it can sound like just a catchphrase, but as we all know, there are some real issues connected to quality, and folks here are interested in figuring out how, from a business standpoint, they're going to be measured and how they're going to meet these CMS mandates. For example, I'm hearing a lot about patient safety, and it's been interesting to me to see how many new tracking tools there are for radiation dose, for example, and business intelligence tools that can help you monitor over time the amount of radiation from various modalities. I think we're going to be seeing more and more items like that and tools like that, solutions like that, so that providers can, as I said, meet one of the quality mandates, which is, in this case, patient safety.
Right.
Patient satisfaction is another one that people are talking about, and I've seen a lot of things to that end too, which kind of ties in with the whole consumerization of imaging.
Gotcha. So between this event and then leading up to the big show at RSNA, do you figure there will be a lot of changes we'll see, or new topics, or further expansion about the topics that you just talked about?
Yeah, good question. I think we will continue to hear a lot about what we're talking about here today, but I think at RSNA we'll also be hearing a lot about information technology, as we have in the past, but bigger issues now, beyond the enterprise, and meeting again new, after healthcare reform or with healthcare reform, all the new ways of doing business and new care models. So technology is going to be a big topic, I think, at RSNA. And another thing that was a huge topic here at AHRA, and I think we're going to continue to hear about everywhere, is reimbursement. As you know, imaging has been hit hard over the last 6 years or so with multiple cuts, and we're going to continue to see that with bundled payments and all. But one of the things that was exciting here at AHRA is that there are also opportunities for growth. I was talking with a consultant and several providers themselves, and they're talking about areas like tomosynthesis, and they're also very excited about the recent news from the U.S. Preventative Task Force, which happened while we were here, and you're probably aware of this, where they basically came out with a recommendation for low-dose CT screening for high-risk patients at risk for lung cancer. So that's not only going to save lives, typically reimbursement follows when the task force makes a recommendation like that. So not only will it help save lives, but I think it's an opportunity for growth for imaging. So that's a good thing in terms of reimbursement.
Great. Well, thank you very much for your thoughts. Hope you had a great AHRA, and we'll be seeing you in a few months at RSNA.
Thank you.
Thank you.